Have y'all seen the research? Look at the research. See that right there? It says therapeutic use of intermittent fasting for people with type 2 diabetes as an alternative to insulin. Interesting. So what is this all about? Well, I'll read the abstract. So let's start off with the abstract, because I know y'all don't like to pay attention for long periods of time. So the abstract is like summary of what happened. All right. So this case series documents 3 patients that were referred to this intensive dietary management clinic in Toronto, Canada. Shout out to all the Canadians. And they all had insulin dependent type 2 diabetes, which means your diabetes type 2 is pretty progressive, right? You don't start off on insulin in most cases. And it demonstrated the effectiveness of therapeutic fasting to reverse their insulin resistance. Reverse. Resulting in cessation of insulin therapy while maintaining control of their blood sugars. They all got off insulin. In addition, these patients were able to lose significant amount of body weight, reduce their waist circumference, and also reduce their glycated hemoglobin level, and find love and live happily ever after. So I made up that last part. Okay, but it's the same thing anyway. So now let's think about it. The economic burden of type 2 diabetes in the USA is over $200 billion. You know how many billions that is? 200 of them. That's a lot of billions. Okay, that's a lot of money. So if people were able to reduce their insulin requirement, people will have more money in their pockets. And who doesn't want more money in your pockets? I want more money in my pocket. Granted, I'm not on insulin, but if I was, I want the savings. I want the savings of being healthy. And we need to understand that medications help manage diabetes, at least acutely. Like I had a patient today that came in. They had DKA, so that means they're in pretty bad shape. Their sugars were all over the place. They're super elevated. They needed insulin. They need to be put on an insulin drip. It saved that person's life. They would have died if they didn't have that insulin available. Okay, so I'm not anti-insulin. All right, don't come after me, Big Pharma. You know, it serves a purpose. However, if that patient had better glucose control through dietary habits, they wouldn't have been in that position. Okay. So now when we go through this, it talks about how drinking unlimited amounts of very low calorie fluids such as water, coffee, tea, and bone broth were appropriate during their fasting regimen. Okay. And fasting is essentially the controlled and voluntary abstinence from all calorie containing food and drinks for a specific amount of time. So yes, if you're drinking that sugar in your coffee, it's not fasting, homie. Just not. All right, so we have 3 different patients. All of these patients have had type 2 diabetes diagnosed for over 10 years. And they all had comorbidities of hypertension and hypercholesterolemia. So maybe, just maybe, these things are all linked together. You know, what are the odds that they all had high cholesterol, hypertension, and type 2 diabetes, which means they all had insulin resistance? You think it's all genetic? Maybe. No, it's not. Okay. So what did they do? Well, one person fasted 3 times per week for 7 months. The other person fasted 3 times per week for 11 months. And the other person did alternate day fasting for 11 months. So here are the different protocols. So patient 1 and 3 followed an alternate day 24-hour fast. So they would eat one day, and then they would essentially not eat after they had their dinner. They wouldn't eat till about dinner time the next day. So they were essentially eating, maybe 2-3 meals one day. The next day they would not eat for 24 hours, and then they just have dinner. So they never went like a day without not having anything. Okay, so I know some people have this emotional, visceral feeling to just tasting something every day. They all were tasting. They're all tasting. Okay, so that's how 2 of them did it. And then another patient, what he did was he just essentially did a 24-hour fast 3 days a week. It just wasn't every other day like those other 2. So it was essentially the same thing. Okay, except for him, he's fasting 3 times a week. The other people probably fasting anywhere from 4 times a week to 3 times a week, depending on how that played out. Okay, so what happened after they did that? So all of these patients were able to discontinue their insulin, But how fast did they do it? That's the question, right? If I can't do this for 20 years. The minimum number of days to discontinuation of insulin was 5. Okay, so one of them stopped insulin in 5 days. And the maximum was 18. It took 18 days for all 3 of these people to get off of insulin. That should be mind-blowing for any physician out there, for any person that's on insulin right now. This should be something you look at, take to your doctor, y'all have a conversation. They were all able to get off of insulin. And now I don't recommend you, if you're on insulin, don't do this by yourself, because you need to understand that you have to titrate down your insulin because you're not eating as often. Okay? All right. So talk to your doctor. And that's not me. All right. All of these patients had an improvement in their hemoglobin A1C, which is essentially an average of your glucose control over the last 3 months. And that's what we all want to see. Okay? So what are the takeaways from this? I'm glad you asked. Medically supervised therapeutic fasting regimens can help reverse type 2 diabetes and minimize the use of pharmacological and possible surgical interventions in patients with type 2 diabetes. Therapeutic fasting is an underutilized dietary intervention that can provide superior blood glucose reduction compared with standard pharmacological agents. Fasting is a practical dietary strategy because it's easy. Just don't eat anything. You save money on the food and you save money on the drugs. It's beautiful. It's a beautiful thing. And with proper education and support, compliance is good. And that's important because in this study, they found that patients followed up with treating physicians on average of every 2 weeks. And that's just not what happens in traditional medicine. You go to your doctor, you don't see him for 6 months, 3 years. Yeah, so for something like this, we need to start having protocols in place and support systems in place where people can reach out to their doctor, through some digital means, whether it's on Zoom or whatever, and have the support while they go on this journey to improve their health so that they don't need to be on all this medication all the time. Come on, people. That's what this is all about. The research is there. Yeah, I understand it's not a double-blind, randomized controlled trial like we're trying to do for all these vaccines and stuff, but it is research. It is essentially validation that this can work for people, right? And if it can work for type 2 diabetics that are on insulin, which are the most insulin resistant people, then it can work for you if you're trying to improve your health too. Okay? So fasting is not just a diet fad. It is healing. Okay? It is therapy. It is a form of healthcare. Okay? So take this information, internalize this information, think about how you want to start your fasting protocol. Do some research. Watch one of my videos. I'm sure I talked about it. Okay. I'll put it up on the screen on how to get started with fasting. Okay. Because I want you to get healthy. I fast every single day. It's helped me maintain a lean physique. I feel energetic. I don't really worry about my weight fluctuating. It's a pretty easy tool to incorporate into your lifestyle. And the best thing about it, for most people, it's a healthy thing to do. All right. So if you like this video, make sure you subscribe so you catch my other videos. And don't forget to share this with somebody that needs to hear this message. Okay. If you care about your friends, you care about your family, educate them on how to get healthier and stay healthier. Take care. Bye.